Welcome to the channel, guys. Today, we're diving into a topic that might just uncover the mystery behind some of those persistent health issues you've been dealing with. Ever found yourself wondering if gluten could be the culprit? Well, you're in the right place. In this video, we're breaking down 9 surprising signs that could indicate you're actually gluten intolerant. From unexpected digestive woes to mood swings and beyond, we've got you covered. Let's get started on this journey to uncover the secrets of gluten intolerance. Starting with number 1, digestive issues. Digestive issues are a common manifestation of gluten intolerance, a condition where the body reacts adversely to gluten, a protein found in wheat, barley, and rye. Individuals with gluten intolerance often experience a range of digestive problems, including bloating, excessive gas, diarrhea, or constipation. These symptoms arise due to the body's inability to properly break down and absorb gluten, triggering an inflammatory response in the gastrointestinal tract. The discomfort and disruption caused by these digestive issues can significantly impact an individual's overall well-being and daily life. Managing gluten intolerance typically involves adopting a gluten-free diet to alleviate symptoms and promote digestive health. Let's move on to number 2, fatigue and weakness. Fatigue and weakness are notable symptoms that can accompany gluten intolerance. Despite getting adequate rest, some individuals with this condition find themselves persistently fatigued and lacking in energy. The underlying cause of this fatigue is often linked to the body's immune response to gluten, which can lead to inflammation and the impairment of nutrient absorption in the small intestine. The resulting nutritional deficiencies, particularly in iron and B vitamins, can contribute to feelings of weakness and tiredness. Seeking medical guidance is essential for a proper diagnosis and the development of an effective management plan tailored to individual needs. Number 3 on our list is joint pain. Joint pain can be an unexpected symptom for those dealing with gluten intolerance. In certain cases, individuals may experience joint pain without an apparent and immediate cause, and gluten intolerance is suspected as a contributing factor. The mechanism behind this connection is not fully understood, but it is believed to involve the inflammatory response triggered by gluten consumption. In susceptible individuals, this inflammation can extend beyond the digestive system and affect other parts of the body, including the joints. It's important to note that joint pain can have various origins, and gluten intolerance is just one potential factor. Seeking professional medical advice is crucial for accurate diagnosis and the development of an appropriate management plan to address both the joint pain and the underlying gluten intolerance. Bringing us to number 4, mood changes, including mood swings, anxiety, and depression, are psychological symptoms that some individuals with gluten intolerance may experience. The link between gluten intolerance and mood disorders is thought to involve the complex interplay between the immune system, inflammation, and the nervous system. In susceptible individuals, the consumption of gluten may trigger an immune response that extends beyond the digestive system, affecting the brain and influencing mood. It's essential to recognize that these mood changes can be subtle and may not always be immediately associated with dietary factors. If someone suspects a connection between their mood and gluten consumption, consulting with a healthcare professional is crucial for a comprehensive evaluation and appropriate management, which may include adopting a gluten-free diet. Number 5, we have headaches. Persistent headaches or migraines can be symptomatic of gluten intolerance in certain individuals. While the exact mechanisms are not fully understood, it is believed that the inflammation triggered by gluten consumption in susceptible individuals may extend to affect the nervous system, potentially leading to headaches. It's important for individuals experiencing chronic headaches to consider gluten intolerance as a potential factor and consult with a healthcare professional for a thorough assessment. Let's move on to number 6, skin problems. Skin problems, such as eczema, dermatitis herpetiformis, or other rashes, can be linked to gluten intolerance in some cases. Dermatitis herpetiformis is a specific skin manifestation associated with gluten sensitivity and is characterized by intensely itchy, blistering skin lesions. For individuals experiencing persistent or unexplained skin problems, especially those with a known sensitivity to gluten, it may be beneficial to explore the potential link between their skin issues and gluten intake. Consulting with a healthcare professional, such as a dermatologist or a gastroenterologist, can help in diagnosing the root cause of the skin problems and developing an appropriate management plan. In some cases, adopting a gluten-free diet may contribute to the improvement of skin conditions associated with gluten intolerance. Number 7 on our list is weight loss or gain. Unexplained weight changes, whether it be weight loss or gain, can be associated with gluten intolerance in some individuals. The relationship between gluten intolerance and weight fluctuations is complex and multifaceted. For those with celiac disease, an autoimmune condition triggered by gluten, the inflammation in the small intestine can interfere with nutrient absorption, potentially leading to weight loss. On the other hand, some individuals with non-celiac gluten sensitivity may experience weight gain, possibly due to changes in eating patterns or metabolic responses. It's important to note that weight changes alone are not exclusive indicators of gluten intolerance, as various factors can contribute to alterations in body weight. A healthcare provider can conduct tests for celiac disease or gluten sensitivity and guide individuals on appropriate dietary measures to address these issues. Bringing us to number 8, numbness or tingling, particularly in the extremities, can be symptoms associated with gluten intolerance in some individuals. The exact mechanisms linking gluten intolerance to neurological symptoms like numbness are not fully understood, but it is believed that immune system responses and inflammation triggered by gluten consumption may play a role. In some cases, neurological symptoms may be part of a broader condition known as gluten ataxia, which involves damage to the cerebellum in the brain. Neurological symptoms can have various potential causes, and a healthcare professional can conduct the necessary tests to determine the underlying factors contributing to these sensations. If gluten intolerance is identified as a contributing factor, adopting a gluten-free diet may be recommended as part of the management plan to alleviate symptoms and improve overall neurological health. At number 9, we have reproductive issues, including irregular menstrual cycles, may be linked to gluten intolerance in some women. The association between gluten intolerance and reproductive health is complex and not fully understood. Some women with gluten intolerance have reported experiencing irregular periods or complications during pregnancy. Comprehensive testing can help identify whether gluten intolerance is a contributing factor, and appropriate management strategies, such as adopting a gluten-free diet, may be recommended to address both reproductive issues and overall well-being. Thank you for tuning in to 9 Surprising Signs You're Actually Gluten Intolerant. If you found this video helpful, don't forget to give it a thumbs up, subscribe to our channel, and ring the notification bell for more valuable content. Stay informed, stay healthy, and until next time, take care.